One of the things that we can use AI for is to help create multiple choice questions for an exam. In this video, I'm going to show you a therapeutics presentation that I give each year on cirrhosis and walk you through how I use AI to create questions. So you can see this particular lecture, let me just move it into slide sorter mode, is fairly typical therapeutics lecture. We've got elements of physiology, kind of pathophysiology, moving into some review of like patient assessment criteria, lab values, talking about some of the signs and symptoms that you can see in patients with cirrhosis, and then we move into some of the complications of cirrhosis, ascites, variceal bleeding, portal hypertension, SBP, etc. And so this slide set is what I'm going to use in combination with a few other things to generate some multiple choice questions. So if I jump over to my AI, I'm going to ask it to create content should come from the attached cirrhosis PowerPoint presentation with attention paid to the learning objectives. Please use the attached PDF article to write the questions in the proper form. And so what that is, that's a paper from AJPE on sort of some best practices around examination and item creation. So we're gonna drop that PDF in as well. Each question should have 5 options. Please also denote the correct answer. Please make the questions case-based when generating drug therapy selection questions. Please give this as a canvas. And by asking it to give it to us as a canvas, we'll be able to edit individual questions rather than having to use the prompt here. All right, so now we're going to add a few items. And then we're going to go ahead and launch that. So that'll just take a moment to generate. All right, so taking a look at our questions here, we've got a decent mix. I apologize for the scrolling. This one looks case-based. The rest of them are relatively straightforward, a little bit more knowledge level questions. This one perhaps is arguably a bit more case-based, so I'm going to give it a little bit more instruction around that. So I'm going to ask it to add in a little bit more detail into case-based questions. And let's see how that goes. You can see the AI is editing these questions. It's still working. All right, so it went ahead and edited our questions. So let's take a look. That first question already, had some case-based elements, but you can see now the question also has things like past medical history in here, vital signs, physical exam, findings, lab values. All right, so the question hasn't changed all that dramatically, but it did add in more of those case-based elements. And so taking a look at, some of our other questions here that were not case-based at all, you can see now that the AI went in and added case-based elements that are relevant to a patient with cirrhosis. Looking at these, I'm not seeing anything, too out of the ordinary. I probably wouldn't include a ferritin for this particular question. For this particular question, I would probably ask it to remove. A question on acute pancreatitis I probably don't really need for a cirrhosis lecture. So I can go ahead and just ask it to remove that question. And then it'll go ahead and do that as it's editing right now. Okay, that one's gone. We'll take a look here. Maybe I want to give an actual ammonia level. All right, so went ahead and added an ammonia level. That is an elevated level. Really anything above 40 would be elevated, but if you didn't have lab values in front of you or something and you wanted that to just go ahead and add in an ammonia level for you, it could do that. All right. So looking at these questions, they're not perfect, but they definitely give you some content to use. And so as I'm scrolling through these, I am seeing that, some of my learning objectives aren't being touched. So when we flip back to the presentation, taking a look at our learning objectives, those questions are getting at pathophysiology, clinical manifestations of cirrhosis, lab value interpretation, pharmacologic treatments, certainly using a case-based format, but I'm not really seeing this particular learning objective being hit. So let's tell it that we don't really see those questions. All right, so let's ask it to generate some PK/PD questions in relation to that last learning objective. So it's still editing, but we can see here that this question gets at the changes that occur in cirrhosis with certain benzodiazepines. So asking about diazepam and what pharmacokinetic change explains the reaction. Here we're looking at propranolol and changes related to decreased hepatic blood flow and propranolol metabolism changes. Here we're talking about morphine. This one's phenytoin. So this one doesn't mention an antibiotic. Let's just ask it. Okay, so it's going to adjust that question. All right. And so it went ahead and added in cefepime, which is a renally eliminated antibiotic. So that did a pretty good job, because if you hop back to my presentation, at the end I talk about PK changes in the setting of cirrhosis. And so, I talk about decreased blood flow here and changes with first pass effect. I talk about CYP1 and 2 metabolism. I talk about changes in highly protein-bound drugs. I talk about changes with hepatorenal syndrome and renal elimination, changes in therapeutic response. And so, those questions, if we flip back here, these questions do touch on pretty much all of those elements that are mentioned in my slides. So this is just a kind of a quick primer to sort of show you how you can use some of the AI tools available to help you generate multiple choice questions, especially for those faculty that need to write many multiple choice questions every year. And the last thing that I'll just show you so that you're aware of what I put in for that that PDF. This was the PDF that I used, best practices related to examination item construction and post hoc review from AJPE. So I used this. and I used my PowerPoint presentation, and then as you saw in the video, I just made some tweaks to individual questions to sort of refine them a bit to get them to my liking.